Hello, I'm Dr. Sue Bornstein. I'm an internal medicine physician based in the Texas Hill Country, and I'm also a gun owner. Today, I want to talk with you about how to talk with your patients about firearm safety, how to initiate non-judgmental conversations that result in an open, trusting exchange. Now, more Americans lose their lives to firearm injury than to motor vehicle crashes each year. Make no mistake, firearm injury is a growing public health crisis and very much in our lane. As internal medicine physicians, we care for patients throughout their lives. This means that we are in a unique position to counsel patients about all aspects of their health, including firearm safety. It's our job to help the patient protect themselves and their loved ones from harm. You can be reassured there are no state or federal statutes prohibiting healthcare professionals from asking about firearm access when the information is relevant to the patient's or others' health. In this video, I'll provide some practical strategies for physicians about speaking with their patients about things they can do to protect themselves and their loved ones from firearm injury. I'll start by sharing approaches I've found useful as I start these potentially sensitive conversations. Do listen to your patients with empathy and ask questions from a place of caring. Your office is a judgment-free zone, and patients can tell you anything that might affect their health. Do assure patients that you are not aiming to threaten their right to possess a firearm. Don't interrupt. Ask a question and then listen. When you respond, tailor your response to address their concerns and be clear about the advice you provide. Don't begin any conversation about firearms safety by directly asking your patients if they own or possess a firearm. Do ask, are any firearms in your home securely stored? If the patient indicates that the discussion is warranted, do offer suggestions for safe storage, storing ammunition separately, and potentially removing firearms from the home if your patient is experiencing or lives with someone who is at risk for harming themselves or others. And now, some final advice. The aim is to help your patients understand the potential risks of firearm injuries based on what matters to them. Use facts that will resonate with your patient. Reassure them you're not judging their right to own a firearm, just doing your duty as a physician to keep them safe. Recognize that the conversation may evolve over time. It may take multiple conversations with your patient to build their trust in having these discussions related to reducing the risk of firearm-related harm. The bottom line is, as physicians, it's important that we invest in conversations about firearms with our patients. It doesn't have to take a long time and can help to reduce the devastating impact firearm injury can have on our patients' health. Nowhere are our voices more important than in the privacy of the examination room. This is where our work is done, where all the research and learning come together. Of all the times and places where we might speak, this is where our voices can do the most immediate good. We must commit to using that time and place to help protect our patients from firearm-related harm.